It's now my absolute pleasure to introduce Professor Michael West, who we did see in the slideshow. He's a friend of ours and spoke previously on the psychology of meditation. And being a practitioner of meditation for many years himself, it's not surprising that in his own career he's also developed a great interest in compassion, being one of the core qualities of the soul, the love that comes from the soul, how it is expressed through compassion. And Michael has many roles. He's a senior visiting fellow at the King's Fund, London, professor of organisational psychology, Lancaster University, visiting professor at the University College Dublin, emeritus professor at Aston University. But I think what I'm aware of that Michael's done most recently is this amazing 2-year inquiry in behalf of the General Medical Council into the mental health and well-being of doctors, caring for doctors and caring for nurses, an extraordinary piece of work. So really, Michael's heard from all the horses' mouths, really, what's going on out there, and made some very powerful recommendations. And then also leading a review into the mental health and well-being of nurses and midwives across the UK. So we're extremely privileged and lucky that he's given us some of his time today to share his thoughts, which have been wonderfully distilled into a book called Compassionate Leadership, Sustaining Wisdom, Humanity and Presence in Health and Social Care. And you can buy that book on Amazon if you're interested. But also present today, who I'll introduce later is Rachna Chawla, who you also saw on the film in the Happy Dote section. Rachna helped Michael to edit and produce that book, so it's through her publishing company too. So Michael, please welcome and share with us the wisdom that you've you've garnered through all your work about compassionate leadership.
Thank you. Thank you, Sarah, for the very warm and gracious introduction. And thank you, and Janti, for giving me the privilege of being here with you this morning. And good morning to all of you. Good morning. And I also want to say, Sarah, congratulations on 25 years of the Janki Foundation and all of the incredible work that that foundation has been doing. Brilliant. So I do want to start by saying something about where we are at the moment. Our healthcare system is facing the biggest crisis that it has faced since the creation of the welfare state in 1948. And it's not unique to this country. And at the heart of that crisis is a workforce crisis. There are, in this country, 130,000 vacancies amongst healthcare staff, and over 165,000 vacancies among social care staff, and both of those two sectors have a multiplier effect on the problems that each faces. What we're also seeing, and have been seeing for at least the last 7 years, is increasing levels of staff stress. This is not a new phenomenon prompted by the pandemic. Levels of staff stress have been rising steadily. In 2019, 37% of staff across the NHS in England reported that they'd been unwell as a result of work stress in the previous year. By last year, that had risen to 48%. Last year, for the first time, a standardized international measure of burnout was introduced into the National Staff Survey in England. That's a survey that has been run every year now for 19 years, and over 650,000 people complete the survey every year. What that burnout inventory revealed was that of those 650,000 people, 35% reported being burned out at work, either often or all of the time. And this measure, this inventory, we know is not just a measure of, yeah, work's pretty pressing at the minute. High scores that I've described on that measure are associated with staff cardiovascular disease, addictions, alcoholism, cancers, diabetes, depression. We also know that doctors scoring at that level on that inventory are between 43 and 62% more likely to make a major medical error in the next month. So we can't go on like this with these levels of stress rising. It's simply unsustainable. We also see huge inequities among staff. Tragically, in the UK, as many countries, healthcare staff and social care staff indeed lost their lives during the pandemic. Of those who died amongst NHS staff, 63% were from a minority ethnic group background. And that's an indication of the health inequalities which result in our society from discrimination and racism, affecting people with disabilities, people from minority ethnic groups, people from lower socioeconomic class backgrounds. So what all of this speaks to, I think, is a recognition that some of the discourse around now is a time to recover from the pandemic is not really what our focus should be. Our focus should be, how do we transform our health and social care systems for the future? Because it's not working at the moment, as is very clear, as you'll have seen from the headlines in the press. So next slide, please. All of this implies some really significant leadership priorities across our health and social care services and amongst politicians. The first is that we have to directly address the workforce crisis, and for reasons that I'll explain in a moment, compassionate leadership has to be at the core of that. We have to focus on how we can create working environments which are inclusive, which value diversity. We have to directly address how we better meet the core needs of staff at work. And though interventions like mindfulness and yoga are really helpful for people, clearly, the challenges we face are beyond those kinds of interventions. There's something much more fundamental that we have to address. And we have to create more collective approaches to delivering health and social care. The purpose of our health and social care systems is to create the conditions in our society where people can live their lives to the full, feeling happy, feeling loved, feeling connected, whether it's young children at the beginning of their lives or people facing the end of their lives. That's the function of our health and social care system, to maximize people's opportunities to live well and happily and fully. So we've also just been through an incredibly difficult period. You know, back in April 2020, virtually all of us, I imagine, had moments when we woke up at night afraid that we might die, or that the people we loved dearly might die because of this unknown virus which was spreading so rapidly. And when we go through very difficult times, it's always an opportunity to reflect. What can I learn from this that will help me live my life more happily, in a more fulfilled way in the future? And the same, I think, for teams and organizations going through very difficult times. And I think by far the most important lesson of the last 2.5, nearly 3 years now, has been the lesson of compassion. The compassion that health and social care staff showed for COVID patients, staff going into work to care for patients when they didn't have adequate protective equipment, personal protective equipment. People from social care organizations camping in the grounds of their residential homes so they didn't bring the virus into residents. Extraordinary courage, and the compassion that health and social care staff showed to each other during this period. In 2020, in the National Staff Survey, we asked staff What enabled you to cope during this first year? And by far the overwhelming majority said it was the support of my colleagues, the team I worked in. That's what's enabled me to cope. And it was also the compassion of people throughout our countries. People stayed at home. They didn't go and visit their loved ones. They didn't hug their loved ones. They didn't go and visit their loved ones sometimes even when they were dying in residential care homes. And that's typical of what we see during human disasters. Across history, around the world, Rebecca Solnit's magisterial book, A Paradise Built in Hell, actually written before the pandemic, describes how typically during human disasters there's a huge upwelling from virtually everybody of compassion. And compassion, I think, is the core message, the core learning from this time. What is it? What does it mean? So the guru of compassion, certainly in the United Kingdom, Paul Gilbert, defines it as a sensitivity to suffering in self and others with a commitment to prevent or alleviate it. But more practically, I think it has 4 key elements to it. So Chrissy, if you're in pain or distress, then for me to be compassionate to you, I have to do 4 things. Attend, understand, empathize, and help. So attending, what does it mean? So attending means being present with you, here and now. Not caught up in thoughts about, oh, what should I say next to be compassionate, or what's just happened, but just simply sinking back into the peace of being present with you. And that enables this, another key element of attending, which is listening to you. Nancy Klein talks about listening with fascination. And attending enables the second element of compassion, which is seeking to understand the causes of your pain or distress, ideally through us having a dialogue rather than me imposing an understanding. And that in turn enables the third element, which is for me to have an empathic response, to feel your pain or distress without making it my drama. And that in turn provides the motivation for the fourth element, the critical element of compassion, which is helping you or serving you in some way. And we know that there is a fundamental difference between empathy alone and compassion. So neuroscience studies show us when we ask people to be empathic to another in pain or distress, that's associated with the activation of various pain centers in the brain. But when we ask people to be compassionate, that's associated with the activation of reward centers in the brain. Now, why? Well, because evolution has shaped us over the eons to be compassionate to others in pain or distress, because from an evolutionary perspective, that enables us to form social groups, communities, tribes, where we can share resources, collectively protect against threat. Compassion is about blurring the boundaries between self and other. It's about a feeling of connection and belonging. And belonging is fundamentally important in human behavior. We're as likely to die from the effects of social isolation or loneliness as we are from the effects of smoking 15 cigarettes a day. And we know a lot more about the role of compassion in healthcare now, from lots of randomized controlled trials and meta-analyses on compassion, and this is just a few examples. The first is a randomized controlled trial of anaesthetists visiting patients prior to surgery, where in one arm of the intervention they provide sedatives, do a normal visit, and in the other they don't provide sedatives, but they're briefed to be extra compassionate. And those patients who receive the compassion intervention have a much lower requirement for painkillers post-surgically, and they have a significantly shorter length of hospital stay. The second example is randomized controlled trials in Italy and North America of patients with an early diagnosis of lung cancer. It was actually a study of quality of life. They were randomly assigned either to normal early cancer care or to normal early cancer care plus early palliative care, so extra compassion, if you like. And indeed, those patients had a much better quality of life. But what was a surprising finding was that they also lived significantly longer. And we see similar large effects of clinician compassion in the treatment of long-term disorders like HIV and diabetes, and of therapist compassion in the treatment of mental health problems. The problem that arises is that when you talk about these findings generally, people working in healthcare understandably say, well, this is fine, but we don't have time. We're just under too much pressure. But actually what the research suggests is that compassion doesn't take more time. It's not so much about doing something extra as about changing what we do and how we do it, changing how we do what we do. You know, you ask patients what they want from doctors, nurses. They want them to listen to them, to be present with them, to understand what their difficulties are, that they want to be cared for, and they want to be helped. But what's also significant is, you know, that in randomized controlled trials where GPs and nurses are asked to be extra compassionate in their interactions with patients over a 2-week period, that has a significant impact on their own well-being, lower levels of anxiety and stress and depression. Compassion is the most important intervention there is in health and social care, and the effects of compassion are truly remarkable. They're huge. The challenge for us in thinking about the future and how we transform our health and social care systems is to address the question of how do we create the conditions within our organizations where staff will be compassionate towards those they provide care for, where they'll be compassionate towards each other, because those two things go together, and where they'll be compassionate towards themselves. And the answer to that question is, well, that's about the culture of our organizations. How do we shape culture? Well, every interaction that every one of us has every day in our workplaces, indeed in our lives, is an opportunity to shape the culture. How warm, kind, cynical, irritable, aggressive, compassionate we are, the emotional and behavioral ripples we know radiate out. But from the last 100 years of research on organizational culture, we know that the role of leaders is particularly powerful. What leaders pay attention to and focus on, and particularly what they model in their own behavior, tells us what it is that they value. Whatever it says on the website about vision and values, it's the behavior of leaders that we read that tells us what's really valued in our organizations. So if we're to develop compassionate cultures in our teams and organizations, leaders must embody compassion in their leadership. And what that means in practice, next slide please, is these 4 behaviors. Leaders who are present with those they lead, who have the courage to listen with fascination, to hear about the problems that they face. We just don't have enough staff to deliver safe patient care. Leaders who seek to understand the challenges that those they lead face, not by imposing their understanding from some elevated hierarchical position, but through having a dialogue, which may lead to disagreement. And leaders who have the courage to empathize with those they lead, to know what it's like to be a nurse on your 3rd 13-hour night shift in a row. You haven't had time to take your rest break. You've been desperate to go to the toilet for the last 3 hours. You're exhausted. You're worried that when you get into the car park, you'll have a parking ticket because you've gone over the time. And actually, you're too exhausted to drive home and really afraid of driving home. And leaders then who have the courage to help those they lead. And in the context of leadership, That means helping those we lead to do their jobs more effectively by helping to remove the obstacles that get in the way and by helping to ensure they've got the resources they need, the right numbers of staff, the right equipment, the right training. And this is not some new model of leadership. We've known for 60 or 70 years that these 4 behaviours are critical to effective leadership. The most important skill of a leader is listening. And the most important task of a leader is helping those we lead to do their jobs more effectively by helping to remove the obstacles and by helping to ensure they've got the resources they need. I mentioned, that the National Staff Survey, I had the privilege of being involved in the design and implementation of that back in 2003. And that's run, as I've said, for every year for 19 years, 650,000 people were able to do the most sophisticated statistical longitudinal analysis. And the next slide, please. And what it shows is that when staff in healthcare organisations in England report that their leaders generally behave in those 4 ways, attending, understanding, empathising and helping, subsequently in those NHS trusts we see higher levels of staff engagement, the key predictor of NHS trust performance, higher satisfaction, higher levels of patient satisfaction, significantly better care quality as rated by the Care Quality Commission, the audit body, significantly better financial performance, and in the acute sector, significantly lower levels of avoidable patient mortality. When staff generally don't report their leaders are so strong in relation to those 4 leadership behaviours, compassionate leadership behaviours, in those organisations what we see subsequently is staff reporting higher levels of chronic work overload, higher levels of staff stress, patients report not being treated with the dignity, the respect, the care that they wish for, and in the acute sector, avoidable patient mortality is significantly higher. So for all of these reasons, we have to make compassionate leadership the core of how we deliver health and social care in the future. And it's important to say, that compassionate leadership is not some soft, comfortable option of accommodating and being nice to people. It requires much more courage and authenticity, I think, than the rather easy opt-out of command and control hierarchical leadership. Because, next slide please, it's about leadership being effective for the people we serve, in the communities we serve, patients, children, young people, adults. So it's about having effective leadership, and what that means is a clear vision of what we're seeking to achieve. And from the executive teams of organisations down to the portering team, the primary healthcare team, that translated into 4 or 5 clear, challenging goals. I've had the privilege of studying healthcare teams now since the mid-1980s, and it's almost axiomatic that what predicts healthcare team performance is teams having agreed 4 or 5 clear goals and meeting regularly to review their performance. 4 or 5, not 45. Because what we see in healthcare organisations is what we've called the priority thickets. There are so many targets and key performance indicators and priorities that no one knows what's important anymore. And then alignment, effective leadership creates alignment, people's efforts being focused on that inspiring purpose and those 4 or 5 goals. By the way, most of the executive teams I meet in the NHS have not agreed clear goals for them as a team. So they're not working as a team. Even the key leadership team in the organisation is not a team. And alignment is ensuring that efforts are directed towards that vision and those goals, not being dissipated on unnecessary bureaucracy or petty interdepartmental conflicts. And if leadership is not inclusive, then by definition it's not compassionate. Because compassion and inclusion are like 2 sides of the same hand. They're both about belonging. If a little girl is excluded from her friendship group in the playground, there's an impact on inflammation of the central nervous system with health consequences. People subjected to discrimination throughout the lifespan, people with disabilities, people from minority ethnic groups, experience a kind of biological weathering effect. which damages health outcomes and longevity. And we also know from all of the research, certainly the research I've been involved in and many people around the world, is that teams that are diverse, that have clear goals and that meet regularly in a positive climate are much more innovative, much more productive than teams made up of people from similar backgrounds. So inclusion is also a performance issue. We also know, by the way, from studies of hospitals across England, that the more that the frontline staff in a hospital mirror the makeup of the community that they serve, the better is care quality and the better is the financial performance. Why would that be? Well, we've discovered it's because patients are treated with much more compassion, where the staff mirror the backgrounds of those they serve. And what does that tell us? It tells us not that we should somehow socially engineer our hospitals, it tells us that we must train staff to be compassionate to everybody that they encounter, particularly those who they may see as somehow other. And compassionate leadership is also about creating more collective leadership. One of the great paradoxes of our healthcare system is we have the largest, most skilled and most motivated workforce in the whole of industry, yet we largely manage them through extended hierarchies and command and control. It's absurd. It makes no sense. So compassionate leadership is about helping everybody to feel they have leadership responsibility and creating more horizontal organizations. We know the only way we're going to be able to deliver health and social care for the populations of our countries is if we work horizontally across boundaries between hospitals, social care, primary care, local authorities, education, employment, housing, voluntary associations, community groups, and families and patients themselves, working in a horizontal, cooperative way. So that requires our organizations become more horizontal, team building, team-based working. And it's about how we work across boundaries. So one of the goals of every team and department in health and social care must be a compassionate orientation to the other teams and departments we work in, always asking the question of other teams and departments, how can we help you so that collectively we deliver more effectively for the people we serve? That should be one of the goals of every team and department, improving the effectiveness with which we work with other teams and departments in our organization. So this is about how we create cultures that deliver high quality care. And what we know is that high quality care cultures have these 6 key elements: clear vision and values in the genetic structure of the organization, not just a bunch of words on the website. Clear goals and good performance data at every level. Cultures of learning and innovation rather than fear and blame. Support and compassion. Equity and inclusion, and team working and inter-team work, cross-boundary working. And I've been working with colleagues over the last 7 years to create a program to support NHS trusts to nurture these cultures within their organizations, and scores of organizations have now implemented this program, and the data show us that organizations which implement all of these tools, the link is there at the bottom, they're open source evidence-based tools, those trusts that now have much better care quality, better leadership, better financial performance, higher levels of staff retention and engagement, patient satisfaction, and so on. So we can make these changes. So next slide, please. The levels of stress that I've described in healthcare organizations we need to address. And what many organizations are doing is putting in place health and well-being programs. Well, we know that those programs tend to be taken up primarily by those who least need them. It is about the fact that we are putting in place programs that are focused on individuals, which is great. Things like employee assistance programs, counseling programs, advice on diet, exercise, mindfulness apps. They're all valuable, but they don't address the underlying causes of stress at work, which are organizational, to do with workload, poor team working and supervision. And the two inquiries that I was involved in that Sarah mentioned, we found that there are 3 core needs that have been identified in research internationally that we all have to have met in our workplaces if we are to be well and intrinsically motivated. If they're not met, stress levels go up and we are much more likely to quit. And the 3 are, we call them the ABC of core needs: the need for autonomy and control, voice and influence, if you like, the need to work in cultures that aren't characterized by fear and blame, cultures of learning and innovation and transparency, and where our basic working conditions help us to feel that we're in control. Northumbria Healthcare Trust, the most outstanding acute trust in the country, has an anonymous Facebook page, COVID Voice, for its staff, as one of the means by which they learn from staff what the issues are that they face. And early in the pandemic, they heard that staff were really afraid because they were delivering care for COVID patients without adequate PPE equipment. They couldn't source it nationally, so they created a factory above a car sales showroom. And between April and October, with local volunteers, in 2020, they produced over 2.5 million gowns and other pieces of PPE equipment for use in their organisation and other NHS organisations and social care organisations. In Merseycare, they actually quite an enlightened mental health and learning disability trust. They learned that their staff were afraid. They were afraid because of the pressure that they were under, that a mistake was going to be made and that they would be blamed or struck off or even prosecuted. And they introduced what they called a just and learning culture that asks 3 questions when something goes wrong. Who's been hurt by this? What are their needs? Who's responsible for meeting those needs? And they've eliminated 85% of disciplinary activities and over 95% of staff suspensions. Many organisations during the pandemic introduced free meals for staff, nutritious food on night shifts. Northern Ireland introduced free parking for all staff. Many of these are now being drawn back, sadly, as though somehow people are fine now. It's not the case. Some organisations, one of the key factors that we discovered that really is so painful for staff is not being able to have any influence over their rotas and their shift schedules. I have caring responsibilities. I have young children. I have got an elderly relative I need to look after. We spoke to 2 female medical students who signalled that they needed to have a particular day off for their wedding later in the year. And both of those we spoke to, both were unsuccessful. One of them told us, I waited until the week of my wedding and they still hadn't agreed I could have that day off, so I quit medicine. It costs over £500,000 to train a consultant, 15 years. It costs around £55,000 to train a nurse. 1 in 4 nurses leave the NHS within 3 years of joining. And we're seeing huge attrition amongst doctors. GP stress is at the highest levels they've ever been since the introduction, at least, of the GP Working Life Survey in 1998. So we have to give people more control, more autonomy, more voice in their lives. And second is the need to belong, which is so fundamental to us as human beings. We need to feel valued and respected and cared for in our workplaces. And it's teams, primarily. It's the teams that we work in that make us feel that way. We found 96% of NHS staff say they work in a team. Then we say, does your team have clear goals and do you meet regularly? And then the figure drops to 40%. A team is a group of people that have shared goals and meet regularly to review how they're performing. So only 40% of staff work in such teams. Yet, we know when people work in teams with clear goals that meet regularly, stress levels of staff are 50% lower. Because teams provide us with social support. They help us be clearer about our roles. We bring our problems to them. They help to buffer us from the negative stuff that goes on in organizations. We also know that the more people who work in a team in an NHS trust, the better is care quality, staff retention, patient satisfaction, fewer errors, and dramatically lower levels of avoidable patient mortality. So there are huge reasons for building effective team-based working. And it's also about creating compassionate cultures, and there's wonderful work now going on across the country. Berkshire Health, a mental health and learning disability trust, has been retraining all its staff for the last 5 years, led by Dr. Deborah Lee, consultant clinical psychologist, retraining all its staff in compassionate leadership. 95% of them have been through the leadership training. Not surprisingly, it's the trust with the lowest levels of staff stress, the highest levels of engagement, and it's rated outstanding by the Care Quality Commission. Wales, with the support of Welsh Government, has introduced a 10-year strategy to develop compassionate leadership across the whole of health and social care. Ireland is all of its undergraduate and postgraduate training for doctors and nurses now incorporates compassionate leadership. Northern Ireland has been pursuing a collective and compassionate leadership strategy for 5 years in health and social care. Scotland has compassionate and collective leadership at the heart of its entire government approach to leadership and culture. And now in England, compassionate and inclusive leadership is at the heart of the people plan for the NHS. But it's all very well having plans. We've got to make it happen in practice. But there's a huge amount of work going on to develop compassionate leadership across our health and social care services, because I think there's just the most enormous thirst for a different way of being and a different way of doing what we do. And the third area that's really important is a need for competence. I need to feel like I can provide the quality of care that I should be providing for patients. And the number one factor that prevents that is chronic excessive workload. It's the number one factor in staff stress. It's the number one reason that staff quit the health service. So if we're not talking about workload, we're not talking about the number one factor in the workforce crisis and in the NHS crisis. I had the privilege last week of speaking to the NHS England board at a dinner here in London. And my key message to them was, your board agenda tomorrow doesn't have chronic excessive workload on the agenda. It doesn't have the core needs of staff on the agenda. You don't have compassionate leadership on the agenda. You don't have how we're going to build team working on the agenda. If we're to solve this crisis, these are the key issues that every board should be discussing. Every departmental meeting should be discussing how we're going to cope with workload. East London Foundation Trust regularly asks its staff, what would you reduce or get rid of in your work? They've eliminated 85% of clinical audit activities. Also, other unnecessary bureaucracy, unnecessary seeking managerial permission, unnecessary travel to trust headquarters. If one place can do these things, all can do them. I've said a lot about team working. The next slide, please. I've said a lot about team working. I'm not going to say much more, but we've been doing it for hundreds of thousands of years, but we've got to get it right. I'm not going to go through all this. We know how to work effectively in teams, but we've got to get it right. I'm trying to make sure everybody in our health and social care services understands that these are the questions we have to regularly address to our teams, from the executive team, from the NHS England board, right down to every primary healthcare team, community mental health team, breast cancer care team. Make sure that we're getting team working right. Next slide, please. And it's ensuring that everybody who works in every one of our teams recognizes that they're responsible for creating compassionate team working, that we're all responsible for that. And that is about being curious about each other and supporting each other. But it's also, compassion is about having the courage to talk about, to bring up the toxic politics between departments, the toxic interpersonal interactions, the chronic interpersonal conflicts. We all fall out from time to time. There are moments of irritation, and we make up and we're stronger as a result. But it's the toxic interactions that do so much damage to healthcare team effectiveness and well-being. We're all responsible for raising those issues through a kind of fierce compassion. You know, Sarah mentioned that that I had an interest in the psychology of meditation. It was the subject of my PhD thesis back in a long time ago. I started working on teams, as I said, in the 1980s, and what we saw was teams, healthcare teams, just spinning the hamster wheel so fast. And I put the two things together in two kind of central themes from my research life: meditation and healthcare teams. And we framed it as a question: what happens if teams stop spinning the hamster wheel and take time out? And that became a key inquiry, if you like, in all our research. And what our research and many others around the world has now shown, next slide please, is that teams that take time out on a regular basis to stop, to review, after action reviews, debriefs, away days, are much more effective, much more productive, and much more innovative, and the well-being of staff is much better. Whether it's primary healthcare teams introducing 2 practice meetings a week, or A&E departments in South Wales taking an hour at the end of each week to review the week and what they can learn from it. Whether it's the staff governance approach in Nottingham University hospitals, where nurses have 95 nurse councils that have 6 hours a week, 6 hours a month to meet to review. Or whether it's medical defense teams in Afghanistan dealing with major trauma, introducing 2 patient rounds a day and 1 consultant round. All of the evidence is that teams that stop, take time out to reflect, what are we trying to achieve, how are we going about it, what do we need to change, are much more productive and innovative. One meta-analysis combining the data from 49 separate studies showed that teams that do this are between 35 and 40% more productive. 35 to 40% more productive when we stop and take time out regularly to review. So the next slide, please. These are the key themes that I've talked about this morning, and I'm not going to go through these. They're an aid memoir for you, and I hope that everyone will have access to the slides. As Sarah said, the next slide, please. I had the privilege during the pandemic of writing this book on compassionate leadership, and the last chapter focuses on self-compassion. The book just came out 2 weeks ago. I had the huge privilege of working with Rachna Chawla to produce this book, and the best bit of it is the cover that Rachna chose. And it's now out as an audio book as well. But the last chapter focuses on self-compassion, and I just briefly want to mention what this is about at 3 levels. The first is how we recover from stressful work. The next slide, please. I don't know if can you see that? Yeah, so Sabine Sonnentag, professor at University of Mannheim, has been studying recovery for some time, and what her research shows is that we recover when we engage in activities outside work that give us psychological detachment, watching a Netflix series, relaxation, meditation, doing something challenging, cooking a new meal. I'm learning French on Duolingo at the moment. These activities help us to detach. Having proper work breaks is important not only for recovery, but also for safe patient care, we now know. and the extraordinary research on the powerful effects of spending time in nature, with blue spaces the most powerful, closely followed by green spaces. This is a reservoir 4 miles from my home in Sheffield, then urban green spaces and being outside. But you know, one of the most beautiful, mysterious findings from this research is we recover most the more biodiverse is the space that we're in. So the more trees, plants, flowers, insects, animals around us, the more we recover. It's beautiful, mysterious. And those who most need to engage in these activities are least likely to do so. The second level, the next slide please, is what we know about the 6 ways to well-being. I'm not going to go through these, but by far the most important we know is spending good quality time with the people we love and who love us. So part of self-compassion is, putting into practice what we know about the 6 ways to well-being. And the next slide, but the deepest level of self-compassion, the next slide please, Toots. Yeah, that's it, thank you. The deepest level of self-compassion is having the courage to be self-aware in the moment. I was telling you about Berkshire Health. They ask their staff in the training, just bring to mind the person you've had the longest, deepest relationship with in your life. You can do that now. Who's the person I had the longest, deepest relationship with in my life? And then they say, well, actually, it's you. How's that relationship going? How kind is that person? How forgiving? How caring? How loving? How much fun is that person? So it's having the courage to ask the question, how am I feeling? What do I need? How can I get that need met? Because we now have abundant evidence, American Medical Association, recent report, lots of research around the world showing that the practice of self-compassion as a way of being is associated with much greater ability to be compassionate towards those we provide care for and those we lead. When we have the courage to be self-compassionate, to accept what we're feeling, inquire into it, and turn our nurturing on ourselves. After all, each of us is as deserving of love as every other human being on the planet. When we connect more deeply with ourselves, with our being, and the core values that give our lives meaning, compassion, wisdom, courage, it enables us to connect more deeply and authentically and courageously with everybody that we provide care for, everyone we lead, indeed everyone we interact with in our lives. So all of this begins with, I think, developing awareness about the importance of self-compassion in health and social care, and indeed for all humanity. The next slide, please. So, thank you. Om Shanti.